Hello guys, welcome to Mr. Coco's Nurses class. And for you to continue receiving the videos, what you're going to do is you're going to simply like the page as well as click subscribe so that you continue receiving new videos as we post. So this morning we'd like to do a procedure called eye bandaging. So if somebody says eye bandaging, we're looking at the eye. So want to focus on the eye, then want to bandage it. But then you can't just bandage somebody's eye. There should be some indications. So what are those indications that we are looking at? So the indications for those maybe who are in foundation, what you mean by indication is what would prompt you to do eye bandaging, or why would you do eye bandaging? So why you would do eye bandaging is because this patient had undergone a surgery, eye surgery, which sometimes can be enucleation. We say enucleation is a surgical procedure. I'm sure some of you have learned about it. Or perhaps there is maybe a swelling of the eyelid, so you can also try to protect the eye by bandaging it. Then you can also have maybe a child who has maybe an injury to the eye or any kind of maybe deformity on the eye. Then at that particular moment, you wouldn't want the child to touch the eye. So what do? You need to bandage the eye. So this is why I want to bandage the eye. So now, if you're given in OSC or you find it on the ward, you can simply do it. So don't worry about preparation of the trolley and everything during OSC, but we're going to do in the next video, we're going to do preparation of the trolley, and we try to give you a demo on how to prepare a trolley and do Tom and Jerry, so that at least you get to know how you can set it up. So now let's start this procedure since I've been given. So you wash your hands the first time, okay, and then you dry. Then you go to the patient. So you greet the patient. Good morning, Mr. Mbula. I am student number 2 and I've been assigned to bandage your eye. May I please go ahead? Mr. Mbula said, yes, I can go ahead. Is there anything I can do for you before I begin the procedure? Okay, I said nothing. So what about where you're sleeping? How is it? You need to check where Mr. Mbula is sleeping. Okay, it's okay. So at this moment, Mr. Mbula, I would like to prepare so that I can come and clean your eye as well as bandage it. Okay, so just give me a moment. So you can go to prepare. So the only preparation you're doing here is just getting the solution. So I'm going to use normal saline. So normal saline, well, is mostly used for cleaning the eye. Okay, so the label is there. So most of the people will touch there. So you can just simply just put the label there and put normal saline. Then this is regarded as sterile field. You're not supposed to touch when you're not scrubbed. Okay. Then next you're going to get this. Okay. So this is just an incontinent sheet. So as you clean, you're going to put there. Okay. So then you're going to put on Mr. Mbula's chest. Then the other thing is that since you need to at least prop him up a little bit, so you can just maybe ask for a backrest or a pillow. So my assistant just kindly give me a pillow. So Mr. Mbula, get your head. Okay. So what you're going to do, since the head has been elevated, let me just scrub. Okay. So at this moment, I'm going to scrub. Okay. So scrubbing doesn't really take much. So what you do by scrubbing, you open up, then you do that, then that, then 1, 2, okay, then you do that. So this is what we call scrubbing, okay, then you close. So the next thing which students would find it very difficult at times is contaminating the sterile field. So this is the moment for you to be very, attentive and very composed. So you need to just ensure that you do not contaminate. So what you do is you pick up this towel. Okay? So it's a hand towel, which is sterile. But then where do you start from? You start from the fingertips, which is here. Okay? In between the fingers. And The first corner goes up to there, okay? Then second corner behind here, then go like that, then pad go around, okay, up to the elbow. Then third corner goes this other side, okay? Then in from the fingertips, in between the fingers and the palm up to there. Then what about the fourth? Okay, so the fourth goes behind here, and then in between, and then just do that. Okay. So after you're done using this hand towel, what you do is just throw there. Okay, just bend a little bit and throw. Then the most critical part again is donning of gloves. So donning of gloves is where mostly students would contaminate. Just check out how they are placed. So you'd find that they are folded like that. So sterile gloves are folded in that manner. So what you do is you just pick here, because when you touch this side, it means that the procedure is over, you have contaminated. So just pick right there, slide in your finger like that, okay, and let go. Oh, sorry, they are torn. Then this other side, you can just simply go in this way, okay? You can touch this side because this side is sterile and this side of the gloves is sterile. So just do that, okay? And do this. Don't mind about the torn glove there, okay? Just go ahead. That's for the sake of demonstrations. But if it's torn like that in the actual sense, it's supposed to wear another one. So let me just pick. I just show you, okay? So in case you had another one, this you can just simply go in like that and glove up, okay? So that you have two. Then the next thing that you're going to do is you're going to prepare the swabs. So let's do the swabs for more like you're doing eye swab, okay? So you need to prepare at least, you need to do for the eye, okay? Now this side, what we need to understand is that there is only one eye which has a problem. So we're going to prepare at least only 4. So you can even add 5, okay, if you want. Okay, so you can do that, try the swabs, and then go to the patient again. So what you do is you need to pick up the drip. So this is a sterile drip which I'm going to use so that at least you clean the eye. So you can imagine this patient came back from theater, okay, like say 2 days ago, and then you're still cleaning the eye because they had undergone surgery of the eye. So meaning that you can introduce microorganisms or infection in Mr. Mvula's eye. So what you need to do is you need to clean before you bandage the eye. So what you do is you get your swabs, okay? So how to pick again? You don't pick using this hand from there because this one will be cleaning. So just pick one, then you drop. Okay, then you start. So you ask Mr. Mvula, I'm starting to clean your eye. So in this case, since this eye had surgery, it's not easy for Mr. Mvula to close and open. So you can tell Mr. Mvula, it will be very uncomfortable and somewhat painful, but let me clean the eye. So you start from the upper eyelid. I didn't get closer so that they see. So you need to go from the upper eyelid, which is this one here. So from inner canthus to outer canthus or nasotemporal direction, that's how we clean. So just simply do that. One swab from the upper eyelid, go. Then you discard. You pick another one, another swab, then you go, that's now upper eyelid, you go to lower eyelid. But then inner canthus, outer canthus on nasotemporal direction. So you do that. Inner canthus to outer canthus like that. Okay, then you can now clean the actual part here, the eye itself, maybe there. I'm sure you'll be able to close because it will be very sensitive. When it closes, at least you clean from this direction to that direction, okay, until it's clean. So you can clean again. So remove all the dirty stuff. If there's blood, you can remove as well. Okay, you do that, and again you continue like that. Now that the eye is clean, what do you do next? You're supposed to now bandage the eye. So what you need to do is you get a bandage, okay? So sometimes they can say you need to soak it in normal saline, okay? So sometimes it can be soaked in normal saline, like this one. Then you can place it over the eye, like that. Okay, so it's placed there, meaning that it's a pad. So this is acting like a pad so that at least this eye is protected. So sterility at this moment is over. So what you need to do now is you need to bandage the eye using a crepe bandage. So you can get a crepe bandage now because sterility is done. So you need now to at least bandage. My assistant just come and help Mr. Mvola to sit up. So we can do that. Okay. So this eye is functional, is using this eye to see. So this one is bandaged. So I'm going to do that. Okay, you start diagonally like that. Then go this way. And you need to ask him, is Mr. Mvula, is this painful? It's okay like this so that it's not too compressed, okay? So you do that, okay? So you can do that again. Okay, so you keep bandaging the eye like that, okay? So this is how you go about eye bandaging because you want the eye to be protected. Even in children, you can apply it, okay? So you can do that. Okay. Okay. Once that is done, meaning that, thank you very much, my assistant. Once this is done, meaning that this eye is bandaged and it is protected. So this is what we call eye bandaging. So I hope you have learned something and you're going to practice because practice makes perfect. So you need to at least go through. Once in a while, you go through the procedures and try to perfect the procedures and perfect a skill. So this is what we call eye bandaging. So thank you very much for watching and need to at least subscribe as you see that button below there. Okay. So other things that you do in this scenario, need to at least remove your gloves. Okay. Remove inside out. Then wash your hands. Okay. Because it counts. Wash your hands and go to the in charge. Okay. So the in charge is there. I'm going to say the in charge. My in charge eye bandaging has been done on Mr. Mvola. Okay, and I've left my patient comfortable. Okay, so other things that you might want to do as well is maybe give Mr. Mvola IEC so that at least you can be able to know why you're putting that bandage and why you're strapping up and why you're covering his eye. Everything that you're doing, you need to explain to Mr. Mvola so that he understands better. Thank you very much.